how is it that a family physician treats differently and is better to go to your family physician first? And how does he look at the matter a little differently rather than going to a specialist?
When we look at medical colleges or big hospitals, the kind and profile of patients that visit big hospitals are different. What we are trained on in medical schools is very different than what we see in community. I'll give you an example of, for example, we also see in our small clinics trauma or injury, but those traumas are different, like, finger prick injury, something, small bruise, child fallen from the bed, old person fallen in the bathroom, somebody, small injuries, those can be treated at clinic itself. But if you go to a trauma center like AIMS, you would say big, fractures, unconscious patients requiring ICU care. Similarly, hypertension is different in community because, like, somebody comes with, headache, for example, as we're talking, and we check and the blood pressure is 220 by 110. Then this person is not having any symptom, only headache. If you go to a emergency department, you would be admitted. Many times you may be taken to ICU for observation, admitted for 2, 3, 4 days. But all these patients can be treated many times in community without any higher level of intervention. And our approach is different because common problems we can treat ourselves, and a number of patients we can deal by ourselves, all specialties. So that is advantage of going to a family physician rather than going directly to a hospitalist, where mostly these days the treatment is procedure oriented. You get your endoscopy done, then you get your treatment, you get your test done, then you get your treatment, you get an MRI, all kind of scans, and then you go for the treatment. But in family physician practice, our investigations levels are very low. Our threshold for sending for hospital admission or for sending for a test is very high. I mean, we do not normally go for test. We would diagnose clinically most of the time. We will talk to the patient, and many times, it's a history. When we talk, have a conversation, we diagnose and we treat accordingly.